So today we're going to be talking about surviving and thriving with chronic disease. So just kind of a background of what we're going to do today. We're going to go into what chronic disease actually is, some of the common types. So we're only going to really talk about 4 types. There are a lot of different types of chronic diseases. We're just going to focus on those 4 top ones that most people experience. We're going to go and talk about the common causes of these chronic diseases, the stigma around chronic disease, and then how we're going to survive and thrive with a chronic disease. So first off, what is a chronic disease? So they're conditions that last 1 or more years, and they require ongoing medical attention, or they limit your activities of daily life. So they can be visible and invisible. So for example, some visible chronic diseases can be things like Parkinson's disease, stroke, or MS, while invisible ones are more likely with diabetes or heart disease. So we're going to discuss both the visible and invisible chronic diseases today. So this is just a graphic just to show the 10 most common chronic conditions. Again, we're just going to talk about 4. But as you can see, just up at the top, at least 80% of adults over the age of 65 have at least 1 chronic condition, and then 68% have at least 2 or more conditions. And then if we really focus on just below that stat, hypertension or high blood pressure affects about 58% of chronic conditions, and then the other big one is high cholesterol, which is about 47%. But then again, there's a bunch of other ones like heart failure, kidney disease, COPD, Alzheimer's, and dementia and depression, but also arthritis. Okay, so the 4 common types we're going to talk about are heart disease, stroke, cancer, and diabetes. Okay, so first with heart disease, previously Mega presented about the heart and kind of how to prepare yourself at home. So I'm not going to go into a lot of info about heart disease, but we are just kind of going to give you a little refresher. So heart disease affects blood flow through your body. So it's caused by a restriction of coronary arteries. So coronary arteries, they wrap around the outside of your heart and actually supply blood and oxygen to your heart. And your heart needs constant oxygen to survive and be able to function properly in the body. Heart disease is the 2nd leading cause of death among Canadians. So it can lead to things like heart attacks, which is when part of your heart does not get enough blood. If you have completely clogged arteries and you're not getting that blood flow to your heart, you get damage to your heart, which again isn't a good thing for us to have. Some of the common risk factors of heart disease are diabetes, high cholesterol, and high blood pressure. If we go back and remember about the last slide we just talked about, you can actually see that things like hypertension, high blood pressure, high cholesterol can also lead to that heart disease. So you could actually have more than 1 chronic condition, like I mentioned before. So it is actually really, really common to have multiple conditions. Perfect. So this is just a picture of a heart. This is kind of just showing on the top left is just a normal picture of what your normal artery looks like, with blood being able to flow through. As you build up things like plaque, which is fat in your arteries, which is the white stuff right there, it makes your artery a lot smaller, so then it's harder for the blood to flow through, as we see in the very bottom. There's not enough space for that blood to flow through efficiently, which is again can cause blockages in these arteries are here, which are the coronary arteries. So then that heart is not getting blood, and then you have a bunch of issues that way. So next is stroke. So stroke occurs when blood flow to part of the brain stops. So it can occur in 2 different ways. So you can either have the blood vessels can either tear, leading to a brain bleed. So that's called a hemorrhagic stroke. So basically you have weakened vessels in your brain, and they can actually rupture and bleed, and then you're going to have blood that will accumulate and just compress your brain tissue, or you can have a blood clot to the brain that's going to stop blood flow. So this is the most common type of stroke. It's called an ischemic stroke. So basically, again, when we looked at that picture of a heart, all that white stuff or those plaque can build up in different arteries and vessels in your body, and that can actually end up traveling to your brain. Your brain cells can actually become more damaged when you got those, when you're not getting enough blood flow to the brain, and they can die. And depending on how the stroke affects your body depends on how quickly you can get treatment. So stroke actually normally affects one side of the brain. So for example, your left side of your brain controls the right side of your body. Your right side of your brain controls the left side of your body. So if you get a stroke in the left side of your brain, you can actually have muscle weakness or paralysis on the right side of your body. There are also other things called a silent stroke, which is a stroke where you don't have noticeable stroke symptoms. And they can actually be more damaging to the brain and the body, because if you don't know if you actually had a stroke, again, you might not get the treatment that you need right away, so it can actually be more detrimental to you. The signs and symptoms also are not related to a normal stroke. So for example, some of the symptoms you might see with a silent stroke are loss of balance, memory loss, changes in your mood, your personality, or issues with any cognitive skills and abilities. And then the last one we have is you may have heard of a mini stroke, which is actually a risk factor to having a more major stroke. So it's just a brief interruption of blood flow to part of the brain. So you have temporary stroke symptoms, but they don't actually damage the brain or cause permanent disability. So these could only last maybe a few minutes to a couple hours, and then your symptoms will subside in 24 hours. So this is the next slide. So this is another picture of talking a bit more about those strokes. So on the right side, this is our ischemic stroke. So again, we're having those blood clots. As you can see, like the plaque buildup here is going to block that vessel, so then blood is not going to be able to get to one part of the brain. Those blood clots can occur down in your carotid arteries. So if you actually have plaque buildup in your heart, they can break off and can travel up your vessels up toward the brain. And then the left is just showing examples of hemorrhagic stroke. So you've actually had weakened of those blood vessels that can actually cause an aneurysm and can allow the blood to just bleed into the brain. So some physical effects of your stroke. So you can actually have communication issues. As we see with face drooping, it's going to be a lot more difficult to be able to speak. We also have weakness and balance problems and mobility limitations. So with that, stroke doesn't just affect your skeletal muscle, the muscle that covers your bones. It can also affect your muscles of your throat. So again, that can cause issues speaking and swallowing, or also it can affect muscles in your bladder. So you could actually have bladder issues with stroke. Next slide. Perfect. So these are just the simplest, or some of the signs of a stroke. So if you can remember the acronym FAST, which stands for face drooping, arm weakness, speech difficulties, and time to call. So it's really important if you notice these symptoms in yourself or in someone else to call 911 right away. And you want to try to get treatment within a few hours if you can to help prevent any detrimental effects. A lot of people think that they could just drive to the hospital if they've had a stroke, but it's really important again to call the ambulance, because the ambulance can actually start treatment right away before you get to the hospital, and they could actually take you to a stroke rehab clinic so they can actually better help you. Perfect. Okay, so cancer. So cancer are cells that grow abnormally and spread throughout our body. So it's when our normal cells kind of turn into cancer cells. So within each of our cells we have DNA. And that DNA is going to be telling our cells when to grow, how to work, how to divide, and to die. What ends up happening with cancer is we get mutations in our DNA or our genes. These mutations can be inherited, they can develop over time with age, or they can be from something that we're just exposed to. So something like UV radiation, for example, or cigarette smoking could cause damage to these cells. So when these genes are mutated, they're not working properly, and they're not following the instructions that they normally should be following. So for example, they could grow uncontrollably, which would actually cause a tumor. They could spread to other parts of your body. They could be dividing too fast and not dying when they're supposed to die. And they, instead of developing into mature cells, they just stay immature and cause a bunch of other issues. So early detection is very, very important for cancer as well, just to make sure we can help mediate our symptoms for this chronic disease. And then this is just a picture of what cancer cells kind of look like. So the top is just our normal cells, and then the bottom are kind of what cancer cells look like. So there's 5 different types of forms you can have. So again, like I mentioned, they can continue to grow and divide to the point where they get really, really big and invade other body parts or organs and can actually cause that tumor. You can have variations in the sizes and shapes, so they can actually stay in mature cells instead of mature. Your nucleus, which is kind of controls what the cell kind of does, can become too large and darker than normal, so then it's going to be doing the things it shouldn't be doing. And again, you can have an abnormal number of chromosomes, or these cells can cluster with each other. Okay, so diabetes. So diabetes is an inability of our body to produce or properly use insulin. So insulin is a hormone that helps to control our body's blood sugar levels. Insulin travels through our bloodstreams and goes to different areas of our body. It controls how our body uses carbohydrates found in certain foods that we eat. So insulin allows our muscle, our fat, and our liver to take the glucose, which is broken down versions of carbs, and use it as an energy source. So if it's left uncontrolled, diabetes can lead to high blood sugar levels and complications such as heart disease, vision loss, kidney failure, nerve damage, and amputation. There are 3 different types of diabetes. So the first one is type 1, which is an autoimmune disease. And the immune system is destroying your insulin-producing cells in the pancreas. And then normally, people who are younger get type 1 diabetes and then require external sources of insulin the rest of their life. Type 2 is a metabolic disorder, so this is normally seen in adults. And it's when our pancreas is not producing enough insulin for our body. And then the last one is just gestational diabetes. So it's a pregnant woman. So when women are pregnant, they're having a lot of changes to their body. So basically, what happens is your body is now not making enough insulin, so you become insulin resistant, and it can actually increase your risk of developing type 2 diabetes after you give birth. So this slide is kind of just showing you how insulin works in our body. So on the right-hand side is showing you how it normally is going to work. So our insulin is going to come in attached to a receptor that will open one side of a cell, for example, and will allow glucose to come into our body to provide energy. So if you have something like type 1 or type 2 diabetes, that insulin receptor, or the insulin's not there. So what you can imagine is going to be too much floating glucose in the body, which will raise your blood sugar levels, which can cause a bunch of other issues. So with all the 4 that I did mention, they all have a lot of common causes with each other. So age is one of the major common causes, and it increases the likelihood as you age to get chronic disease. But as I mentioned, you can be younger and still get a chronic disease. Hypertension, so high blood pressure. If you go back to with heart disease, if we have too much plaque buildup, again, those arteries are going to constrict, so our blood's not going to be able to flow through to provide oxygen to our heart and the rest of our body. Tobacco use and exposure to secondhand smoke. So these are toxins that can not only damage our cells, but they can cause our blood to thicken and form clots. Then we have poor nutrition and lack of physical activity. So these are kind of a domino effect that lead to a bunch of negative effects that can cause chronic disease. And then excessive alcohol use. So if you excessively drink alcohol, it can cause blood clots, inflammation of your pancreas, which impair impairs your ability to secrete insulin. Okay, so stigma around chronic disease. So the word stigma is normally associated with a negative meaning, and Western society sees aging and chronic disease as a bad thing, and it normally is less accepted. But what's really important is we want to make sure that we're not letting the disease control our lives. So chronic disease can be really debilitating. What's important to find ways to cope with our symptoms, to minimize our disability, and also just be really open to change. So for example, if you've never exercised before and you get told by the doctor you have diabetes, it's always nice to be open to different changes and starting an exercise program to help with your symptoms. With that, we also need to normalize chronic disease. So just because you have a chronic disease, it doesn't mean your life is over. So it's really important to have a positive outlook on life and a positive attitude. So when Marcia actually did her presentation, talking about body positivity and positive self-talk, so just really practicing that, being nice to ourselves. So if you wouldn't say something negative or mean to someone else, why would you say it about yourself and to yourself? And then also just having a behavior change and learning to function with your new role with a chronic disease. Changing your behaviors can also control your negative emotions and can control anxiety, depression, and limit isolation that's normally seen with chronic disease. Okay, so how to survive and thrive. So these three major ways to survive and thrive are common themes of our wellness workshops. So exercise, nutrition, and mindset. So with exercise, we need at least 150 minutes of moderate exercise a week, but only about 10% of the adult population is actually getting that amount. 150 might sound like a lot, but break it up over time. So for example, you could go for a 10-minute walk, like in the morning, afternoon, and night. So you only need 150 minutes over the entire week to keep healthy. So resistance training or cardiovascular exercises are a great way to help with your chronic diseases as well, because they have a bunch of benefits by helping your blood sugar levels, strengthening your muscles, your heart, your brain, and it can protect from a bunch of different cancers. So for nutrition, diet has a large correlation with chronic disease development. So I've just listed a few things that you can do to help with chronic disease. So decreasing your sodium intake will help with your blood sugar levels or blood pressure levels. So trying to eliminate how much fast food you eat or salty foods such as chips. We want to increase our good cholesterol. So eating things like vegetables, fruits, whole grains, and protein help to lower your risk of heart disease. And then eat the rainbow. So if you've ever heard the term of eating lots of colorful fruits or vegetables, color signifies a bunch of different nutrients that can help to fight a variety of chronic conditions. So I'm actually going to list a bunch of different ones. So anything that's red you want to associate with your heart. So red vegetables, fruits help to lower the risk of heart attacks and cancers because they have a bunch of antioxidants in them. Orange or orange foods, so oranges, orange peppers, things like that. They have vitamin A in them, which are good for helping to keep our immune system strong. So brown, so things like lentils, they have folate, vitamin, and amino acids, which help to prevent blood clots from forming. Green foods have phytochemicals that have anti-cancer properties, and then leafy green foods help to reduce the risk of heart disease. And then purple have antioxidants and anti-inflammatories in them for reducing cancer, heart disease, and can also help with arthritis. But then also we want to decrease our alcohol consumption as well. And then our last one's mindset. So again, we want to make sure we have that positive outlook on life despite what challenges we are currently facing. Just because you have a chronic disease or may have risk factors, it doesn't mean your life is over. There are still a lot of good things to enjoy in your life, and increasing exercise, changing your nutrition can have a few ways to improve your quality of life or your activities of daily living. And then the last thing I just want to mention about that is your mind is something you can always have control over. So you may not have control about having your chronic disease, but you can control how you think and how you react to your chronic disease. And then how can Heart Niagara help you? So there's a bunch of different services here that can help you. So coming to your hardcore appointments, joining the exercise classes with Diana. There are a bunch of ones she teaches. So stretch, boot camp, functional movements, body pump, or chair dance. And then we have nutrition tips on our websites and social media pages. You can also come to our Heart Niagara yoga classes to help with your mindset. So we have hatha yoga, stick yoga, chair, and we also offer a sound spa. And that's everything. Thank you.
Thank you, Haley. That was really good. We'll give a moment for our virtual audience to type out their questions if there's any questions out there. But in-house, do we have any questions or anything? Yes, Laurel?
The 150 minutes of exercise, how does the hardcore fit into that?
So if you do your hardcore, it's your resistance training. So your appointments are like 10 minutes long. So that adds up. So, excuse me, so for example, come twice a week, that's 20 minutes already taking in. You could also add in going for a walk. So if you walk to hardcore, that also adds in things like gardening, walking up and down your stairs in your house. So as long as you're just moving, so you really don't want to limit your time sitting. Because that's also not the greatest thing for you, so try to move as much as you can. And those 150 minutes will actually accumulate a lot quicker than you think. It is a big number, but the more you move, the better you will be able to achieve that number.
And I would like to also add, even doing a stretch class or a yoga class does add up into that 150. You might not be moving, but you're definitely benefiting your body at the same time, as well as your mind, so it kind of coexists with that number as well. Anyone else in-house? Bob? Yep.
I understand the exercise. What about nutrition? How important is that?
So we always want to try to eat healthier.
Yeah.
I always like to say you want to have a balanced diet. So not only is fruits and vegetables really important for the things that I mentioned, but having a healthy nutrition, so eliminating your sodium, eliminating the bad cholesterol, that kind of stuff, it will help to decrease the amount of things like plaque developing in your body, which will prevent or even decrease your blood vessels from getting smaller, so then you're basically to be able to get more oxygen through your body, but it also just helps you make you feel a lot better, more energized, things like that.
And before we go back to in-house, let's just check our virtual. Anybody got a question out there? No? Anybody else in the house has a question? No? Alrighty, I guess this will wrap up chronic disease and how you can thrive and survive. Next week is our last presentation. I know, right? Last presentation. And we're going to end it on a great note. We're going to talk about goal setting for 2022. And that will be done with Rebecca. So thank you everybody for coming in-house or virtual. And we will see you next week for our last presentation. Good job.